Understanding your body can be favorable for your health as you get older. Knowing your blood pressure can be highly beneficial to prevent strokes, heart disease, and kidney problems. In this short video, you will learn everything you need to know about your blood pressure. Anyone can have high blood pressure, regardless of your age, race, nationality, or gender. Many people suffer from high blood pressure and have an increased risk of stroke and heart disease than regular blood pressure. What is high blood pressure? High blood pressure is the power of blood on the walls of the arteries. Your blood pressure continues to rise and fall throughout the day, and if it increases and keeps up that way for a long time, you have high blood pressure. High blood pressure is generally known as hypertension. When you have high blood pressure, it imposes more pressure on your heart, making it riskier than ever. Consequently, you are at risk of having a stroke or heart disorder. What is the normal level of blood pressure? Normal blood pressure levels are under 120/80 or less. The main number is your systolic pressure, and the second is your diastolic pressure. Their numbers are 120/80, etc. If your pressure stands 140/90 or above, you have blood pressure. Do you know what is systolic blood pressure? This is the blood pressure in your arteries when your heart beats. What is diastolic blood pressure? This is the blood pressure in your arteries when your heart is resting. What are some of the risky conditions for high blood pressure? The most common threats for high blood pressure are strokes and heart illness. There are numerous other risk conditions that can be changed, and some are not. The following are some of the risks: physical inactivity, diabetes, unusual cholesterol, overweight. Now, the fundamental question is, who can have high blood pressure? Unfortunately, anyone can have high blood pressure, but this is more common among African Americans. Almost every third American grown-up has high blood pressure. African Americans also have an increased death rate from kidney illness and stroke than white Americans. However, with therapy, this can support lower blood pressure. How do I lower my blood pressure? In fact, there are numerous different ways to encourage lower blood pressure. Training is one of the best ways. Physical activity will strengthen your heart over time. If you have a healthier heart, you can pump blood more easily to reduce the risk of stroke and kidney ailment. It is not too late to start training. If you are interested about your blood pressure, see your doctor. Ask any questions you may have and find the best way to reduce them. If all traditional methods have failed, consider treatment. Talk to your doctor about your health and lifestyle so that he can choose the best treatment for you. If you want to live a healthy life, it is very important to control your blood pressure.
Who can acquire high blood pressure? Do you struggle with high blood pressure? Do you feel like you are the only one? This should not be, because millions of Americans have high blood pressure. Only a distinct percentage of them really know. When you visit a doctor, your blood pressure is checked. Some people think it doesn't matter because they say they will never have high blood pressure. This is probably one of the reasons many people don't even know they have it. For some reason, they think this will not happen to them. While it can be difficult to control blood pressure, there are things you can do to help lower it or keep it in check. Exercise is a great way to lower and control your blood pressure. About 1 in 3 adult Americans have high blood pressure. Although high blood pressure is very common among Americans, African Americans tend to have it at a young age and more often than white Americans. Regardless of your age, gender, or ethnicity, you can easily prevent and control your high blood pressure. There are simple ways, such as exercise and even simple lifestyle changes, to do this. If you are overweight, you have an increased risk of high blood pressure. The higher your blood pressure, the higher the risk of stroke or heart disease. Exercise can help you lose weight as well as lower blood pressure. Eating healthy is also a good way to control your blood pressure. Eating the right fruits and vegetables and eating together is very healthy. The use of less salt and sodium is of great importance, as well as the use of very small amounts of alcohol. Tobacco also raises blood pressure, so if you smoke or use a tobacco product, you may want to consider limiting yourself if you do not stop smoking altogether. You may have an easier time getting away from it slowly. Stress plays a big role in blood pressure, and let's face it, everyone is stressed at some point. If you are feeling a lot of stress, you should try some relaxation methods. Think about meditation or what relaxing. Do this when needed and you will feel a significant improvement in your emotions. Do you know that the cause of 90% to 70% of high blood pressure is unknown? Fortunately, high blood pressure can easily be detected and controlled in several ways. Other interesting statistics show that people with lower education levels and even income tend to have higher blood pressure. Do you wonder why that is? Maybe this is a lot of stress. Regardless of who can develop high blood pressure, it is important to control it. If you are struggling with high blood pressure or just want to take the necessary precautions to prevent it, consult your doctor. Ask each question and they can help you find a good effective way to lower or control your blood pressure. Don't forget to exercise and try eating healthier. Generally, it will do wonders, and eventually, you will be able to thank yourself when your body does.
Preventing high blood pressure. If you are battling with high blood pressure, there are many ways to lessen it and prevent it from emerging. The best way to get started is with no medication, if you can care for by making some lifestyle changes. Do you smoke? If so, it can raise your blood pressure. Try to reduce it if you stop smoking. There are many benefits that can help you quit smoking. Do you drink a lot of alcohol? It increases your blood pressure, so try taking 1 or 2 drinks a day. Do you consider yourself to be active on a daily basis? Doing at least 30 minutes of exercise a day has been shown to reduce and maintain a healthy blood pressure level. Take a 10-minute interval if you cannot reserve 30 minutes at a time. Start a healthier diet. Did you know that salt dramatically raises your blood pressure? Limit your salt intake or replace it with other spices. There are so many different spices available that you should have no problem finding the one you really like. Add plenty of fresh vegetables and fruits to your diet. It will also help lower and control your blood pressure. Also, try to stay away from fatty foods. If you are overweight, it can have a significant impact on your blood pressure. Losing a little over 10 pounds can significantly lower your blood pressure. When you lose 10 pounds, you will see how easy you are to lose, and you will notice how good and healthy you are. Not to mention, your blood pressure levels are dropping. Do you have a stressful job or life? Try to remove all the stress you can. If you can't avoid all the stressors in your life, look for something that will help you relax and relieve stress. Meditation can work wonders for you. If you have a family history of high blood pressure, early prevention will begin. Knowing your family history can help in cases like these. Even if you don't have high blood pressure right now, you're in danger of developing it eventually, but it doesn't have to happen. Early prevention may keep blood pressure low. Avoid pain medications and relievers if possible, as they can cause high blood pressure. Some prescribed medications can cause high blood pressure, such as nasal decongestants, anorexia medications, steroids, antidepressants, oral contraceptives, and cold medicine. If you take these and have problems with your blood pressure, make sure your doctor knows you are taking them. Having high blood pressure can increase the risk of stroke, heart and kidney disease, so avoiding it can greatly benefit your health. Talk to your doctor about any questions you have or have concerns about. There is no question that it is stupid and not too early to start taking care of your health, which starts with your blood pressure.
What can you do if you have high blood pressure? If you have blood pressure problems, there are a few things you should know. The first thing you want to understand is what the numbers mean. Your blood pressure read in a higher or lower number. The top is your systolic pressure and the bottom number is your diastolic pressure. Normal blood pressure is 120/80, so if your blood pressure is 130/90, you risk developing high blood pressure. This reading is called prehypertension, which is usually a stage before the development of high blood pressure. By monitoring and controlling your blood pressure, you can often lower it if necessary. The best way to do this is to maintain or adopt a healthier lifestyle. Have you had normal blood pressure until recently? If so, consider what you just started to do differently that may have caused it to rise. Have you changed your diet? Are you used to it? Maybe you medicine. Some medications may cause your blood pressure to rise. If you have hypertension, you can easily monitor it at home if you want. If you do this, you will still have your regular doctor visits. You can share your own results and you can see what is not working for you. If you are taking other medications, consult your doctor. Chances are that one of them can raise your blood pressure and want to get it checked as soon as possible. If your blood pressure gets too high without proper treatment, you have an increased risk of having a stroke or heart and kidney disease. If you have changed your diet recently, talk with your doctor, especially if your blood pressure has increased since then. Too much salt and sodium can cause high blood pressure and insufficient fresh fruit and vegetables. If so, try to limit your salt intake and get more vegetables in your diet. Also, physical inactivity can cause high blood pressure. Have you recently stopped exercise regularly? If so, consider starting again. It can be stopped because of an inevitable, broken bones and so on. If this is the case, talk to your doctor. Together they can find a way to get physical activity in their daily routine. You will also restrict or limit your consumption of tobacco and alcohol use. Many people are not aware that they cause high blood pressure. Many medicines without a prescription, and even the doctor prescribed medicines to help you quit smoking. There are also many different resources to help you stop drinking. If your doctor prescribes blood pressure medications, make sure you remember to take them. Some people do not remember taking the medication. There are many different ways you can help yourself to remember. You risk getting a stroke or heart disease by not taking your blood pressure medication. This should be a sufficient reason to take your medication, but sometimes people forget it. Although this may seem like a good reason, it is easier to forget if you are not used to taking medicine daily. If you have any questions or concerns, talk to your doctor. They will answer any questions you have, and will do their best to get your blood pressure down to a normal speed.